Welcome to the Cuddler Chronicles, pain-free living beyond the body, but today it is about the body. It's just a different section. If you have ever had any gut or hormone issues, you know going into the medical system, you might be passed around like a hot potato, and that definitely falls into the category of a pain in the... Anyway, with that in mind, I have Dr. Kailee Karst with me today from Mindful Movement, Physical Therapy, and Yoga.
Yes.
Correct? All right. Mm-hmm. I'm glad I said that right.
Yeah.
So, Dr. Karst, this is one of the things. First of all, thank you so much for being on the show.
Yeah, I'm really excited to be here.
Good. I'm very curious because when you think physical therapy, you don't think hormone regulation, dealing with the menstrual cycle, nutrition even. You don't think about it that way. So what got you from doing your doctor of physical therapy to being so focused on women's health issues and organ issues? And
yeah, absolutely. So I started my business about 4 years ago, and my goal was to provide direct one-on-one care and physical therapy. And I focused on women's health, so pelvic health, prenatal, postnatal, lots of different conditions. And a local nutritionist also started her business at the same time, and we became quick friends. And she told me 2 tips about managing PMS with food, and my mind was blown. And I was like, everybody needs to know this. Why aren't we taught this? And so shortly after, we started writing a book. And the book is called Eating and Moving for Your Cycle. It's actually available now after 4.5 years of writing, which is really fun. So we spent 4.5 years deep in the research because if you have a period, there's lots of nonsense out there. So I feel like a big barrier to health these days is that life is a game of truth and nonsense, and some of the nonsense sounds really good. And so our goal was to provide...
That's the best nonsense.
Yeah, exactly. I know. It's what sells and what gets clicks and all of that. And, the truth is, overall health, a lot of the basic things aren't super sexy or exciting, but they're really important for hormone and overall health. So our goal was to kind of demystify the period and then also provide an evidence-based source for people who menstruate. And so we have over 800 PubMed sources or something like that. We spent 4.5 years researching, and we did our very best to make sure that it was as up to date with evidence as it could be.
Right.
And so with that, I'm a physical therapist, and I switched my specialty within PT to focus more on abdominal manual therapy. And so on top of writing a book all about hormones and the body, at the same time I was intensively taking coursework on organs and manual therapy for organs. So learning how to work on things like your kidney, your liver, your small intestine and stomach. And the coursework goes hand in hand with the book because you're learning about where things are in the body and how they function, which goes hand in hand with learning the nutrition and how the body works as far as hormones go. So it's really kind of come full circle with that. And so with being so deep in the research, and I edited the book a lot, so I'm very deep in the nutrition research. I started offering online wellness, and one of my goals with that is physical therapy is great, and I love what I do in clinic, but I'm really limited geographically.
Right.
If you're in Richmond, come see me. Would love to have you. Yeah. But my goal is to help people. We live in a time where there are care deserts, where people may not have providers they trust or who are giving them the best advice for them. So my goal with wellness is the same thing as PT, where I really want to get to that root cause.
Right.
So it's a lot of medical history and kind of sifting through like what's going on in your body, what have doctors explained to you, what medications are you taking, do you know why you're taking these medications? Because a lot of times there's a disconnect between what people are taking and whether they know why they're taking them. They're just like, oh, this is for this condition, and it is for that condition, but it also treats something else that could be managed with nutrition and movement.
Right.
So it's kind of just breaking down health in a way that's accessible for people who are within the system. And I had my first online wellness session last month, and it was so lovely.
Nice.
And it's just... Again, it's just helping people manage all of the information they're bombarded with, because a lot of times what happens in the wellness world is people get analysis paralysis. So it's like, never
There's
do
so
this,
much.
always do this,
Right.
don't do this. Why would you ever do this? Oh, like, only eat this one group of foods, never eat that group of foods. And so then people are left to their own devices. And, you know, I study this for a
Who do
living.
I
So,
trust?
yeah. And so it's like taking a step back from all of that noise and just starting with the basics with, you know, walk me through your day. Like, where can we just like work within your environment and optimize within the environment you're in, you know, within the time
So it's not
that you're
just
in.
treating, it's also
Yeah.
coaching.
Yeah,
Right?
exactly.
Trying to walk through it with people.
Yeah.
That's amazing, because there's
Yeah.
so many different specialists that you see this person for this and this person for this, and they don't talk.
Yes, and
You know?
yeah,
And
huge
we were talking
problem.
about that before, about how like specialists don't normally communicate with the primary care physician. So how are they going to coordinate care
Yeah.
if they don't get any information?
100%. I
Yeah.
mean, and you know this as well as I do. It's like, yes, you have foot pain, so go to a podiatrist, but also is your foot pain from your back or your ankle? So, you know,
Right.
it's that same principle. We think about that orthopedically as physical therapists and chiropractors,
Right.
but it's that same principle within the wellness world of, you know, who are you listening to? What are you doing? Why are you doing that? And kind of like breaking down the why behind the habits, or forming habits, you know, in general, because the person hasn't started because they're just too overwhelmed.
Right.
So it's been really fun. So,
And a lot of times you get a lot of bad information just because that person is charismatic and good looking.
and that's, and I think that's the frustrating thing with influencer culture right now is that, yeah, the people who do the best at selling, it's really hard to know what their background is, where they have studied, how they've
Right.
been trained. And
Right.
again, they may be a great person or coach or whatever, but are they the best coach for you? Because we forget that each body is individual. So, you know, somebody
Absolutely.
may, and a lot of people base it on themselves. They're like, N of one. So if you had a study, a lot of times people write about their experience with a certain diet trend, and that's fine if it works for them. But you also have to take into consideration that their body isn't your body.
Right.
And, you know, a lot of times these studies, or like how they're talking about something, is in the moment. And so there's no 6-month, year-long, 3-year
Right.
later follow-up of like, okay,
Right.
you were doing this diet trend for 6 months.
Right.
Are you still doing it? How do you feel? Can you still be consistent with it? You know, did you have any side effects from it? And that's kind of the piece that we're missing when it's so moment by moment of like doing the one fad in this moment. That's what
Right.
you see versus how does it affect health long term?
Absolutely. And that's one of the things, you know, I have gotten a copy of your book. This is Eating and Moving for Your Cycle. And what she was talking about with all these references, I have one of my business cards in here because this amount of the book is just the references, which is awesome. And I love it. And for the nerds, there's a good 55 pages of science at the beginning.
Yeah.
But you also tell people, if you don't want to read that, skip to page 69.
Yeah, and that's exactly, and it's funny because my mom helped edit, and every
Okay.
time when we were doing the beginning part of the book, she'd be like, I just want to get to eating and moving for your cycle. Because the first part, and that's where, you know, the basics, that part is great if you have never been taught, which again, education can be so hit or miss. Some people are taught things, some people aren't. So it's just like kind of the baseline of how do hormones work? How does your nervous system work?
Right.
How, like, you know, how does everything integrate? Because like you were saying before, often in Western medicine, we take hormones only or nervous system only or, you know, stress management only. And it's
Right.
like all of these systems have a cascade where one thing you do influences everything else.
Yeah.
And so that's where if you don't talk to your client, you just don't know the missing piece. And
Right.
and it's been cool. I've been using the information even within my physical therapy practice too.
That's awesome.
Because inflammation affects joint pain and
Right.
arthritis and all sorts of different conditions. But it's also an era where, like with Western medicine, sometimes we overprescribe CTs, MRIs, imaging when it's just a orthopedic problem that a
Right.
chiropractor or a PT could solve. And it's the same thing with wellness right now, where functional medicine has become a really popular thing. And I started a functional medicine training, which I'm really excited about. I'm very early in it. But the problem sometimes, depending on who you're going to with that, is that there's an over emphasis on labs, and I sometimes, depending on practitioner, and it's really important before you look at all of that data to like figure out the baseline, because a lot of times the patient tells you what they need. You just have to listen.
Right.
So.
Right.
Yeah.
And, you know, the thing with labs to me is that people love blood work. They love blood work. And the way that I have tried to explain this, now, it's been 10 years since I've done any research or any work with hormones and all that. I mean, it's just, I'm more orthopedic, muscle and joint pain. I can get you out, right? But, you know, I tended to explain it to people like this, that blood work is so transient that it's like saying you know what's happening in a movie because you saw a still photograph of the trailer. You know what I mean? And that's what it sounds like you're talking about. Yeah. And then another thing that I say all the time to people is that your body doesn't care what the textbook says it should feel like.
Yeah.
So it seems like you're taking both of those concepts, and that's a big part of the patient care aspect of what you're doing.
Absolutely. And it's just, you know, taking the data that there is and kind of filling in pieces. But kind of like you're saying, the lab work is great, and it definitely holds a place, and it can give you more information. But if you're getting lab work and you don't know the root cause, sometimes the lab work isn't the root, it's just an effect of whatever else is happening in the body.
Right.
And you know, and the thing that we don't talk about enough culturally too is under eating and how that affects the body. So it's really important to make sure that you're eating enough to fuel your body, because if you're not, all the hormones and all your labs are going to be so dysregulated. So you could spend years trying to figure out why am I inflamed? What's going on? Why is this high? Why is that high? But until you address the underlying problem, which, you know, it could be under eating, it could be types of foods you're eating, different things like that. Until you address those things, you're not going to feel better, no matter how many labs you get.
Like, well, it's like this culture, like what you were saying, clickbait stuff, you know, where it's like, all of these little things, like this is the thing you need to do, but you can't intermittent fast every day, or your body's just going to completely switch and it's going to have no effect after a while. You know,
absolutely.
All of these little things where it's like what they used to use the term as panacea, where it's like that one thing that's going to fix everything, and it doesn't exist.
Well, and I think the hard thing too is that that's what we all want. I mean, we live in a time, and I'm sure you see this. I'm sure you see this too, but a lot of people just don't feel well. And there are so many components to that, and I just don't think our medical system is prepared to deal with where we are mentally, physically, emotionally right now. And so I think that plays a big component as our health system is overwhelmed, and a lot of the stuff that's going on physically is a manifestation of all the different things, you know, stress management, lifestyle, stress impacting sleep. So, you know, it's really important to figure out, are those things contributing as well? And sometimes you can't change the stage of life you're in, but there are always things that you can modify and kind of like biohack, even if you can't switch the whole phase of life that you're in.
Keep it from getting worse.
Exactly.
Kind of like arthritis. I can't stop the degeneration of your joint, but I can help to make you more balanced so that you don't keep wearing out the same way.
100%. And then the other thing too is education, because even with things like arthritis, you know, helping people understand that just because an image shows you have arthritis doesn't mean you have to have pain.
Exactly.
And so there's that balance too of like, what have you been told in the medical system? What have you been diagnosed with? How do you feel about that? But also, let's take it from like you are or have this diagnosis to, okay, I'm working through this. What can I do to optimize how I feel within the circumstance of...
I think that was big in the question that you just asked. You have this diagnosis. You are not this diagnosis.
Exactly.
It's not your identity, you know? And that's important for you to say, because there's all of this new research. I'm not sure if you've seen it. You know, it sounds like you're really into research. But all of this research that I've seen in the past 8 years or so is that the amount of damage to your knee doesn't correlate with how much pain you have in your knee. You can have very little damage and a lot of pain, a lot of damage and very little pain. So it's all of these other factors, and at least my thought in the system, like overall looking at the system, let me know if you disagree. But the medical system was kind of set up for the germ theory, like there's something that's attacking you and that's causing this. But if it's the buildup of things, with your posture or your nutrition or hormone dysregulation that just keeps getting worse because it feeds back into itself and makes it worse and worse and worse, then we're not really set up for that.
No.
And if you have this, there's a germ that's causing this, and now I have a diagnosis code that I can give you, you're going to get confused.
Yeah.
You're just going to keep throwing diagnoses at it, and if it's more than one thing, what are you going to do?
Well, and that's exactly it, is, thinking about even things like Lyme's disease. It's super prevalent, but it's not often just the Lyme's.
Yeah.
It's like co-infections that go with that, and how they influence like gut and the gut barrier. And so there's so many different things. So I tell my people all the time, so you're like a bus. Our goal, the symptoms are passengers. So you may have hip pain, or you may have knee pain, you may have arthritis, you may have all these things going on, but our goal is to find the driver of the bus, because you can treat each one thing individually, which is what our Western medical system does, is this drug for this, this for this, like looking at only that one piece, podiatrist for ankle.
Right.
But what we really need is the people who look at the ankle like you do, and look at the whole kinetic chain and are like, okay, yes, let's address the ankle, but then let's look up, do you need to strengthen your hip?
Right.
Do you need to take weight off that area that's taking the stress? And it's the same thing physiologically with that give and take.
Right.
When systems are overwhelmed, it's like, what can we support to take the stress off of that system? And how can we support you as a whole person as well?
This is so needed, because there's so many people, and I'm sure you know this, but there's so many people that are just like, I've been through the ringer and I'm so tired and I don't know what's going on, and nobody seems to either.
And so this is funny, because I joke with my clients all the time, you find me when you need me, basically, for physical therapy. What I found is that that tends to be the story when people come in to see me. There are cases where it's not, but a lot of times it's like, I've just been so many places, I'm exhausted, I'm overwhelmed. And the other thing that we don't really talk about is medical trauma, and how Western medicine, with how fractured it is and with how small the appointment times are, so with how little time you get with your clinician, and it's not the clinician's fault. So it's this it's this space of like, you have to understand that the clinicians are doing the best that they can within an environment that doesn't support them as people or as clinicians. And then on the other end, clinicians need to understand that when somebody's coming to them and explaining what they're feeling in their body, that sensation that they're feeling is valid and real.
Right.
And that they would like you to look them in the eyes and like explain what's going on, or provide something that's more than your interpretation based on either just like glancing at their note or them saying one sentence. Like we need to kind of like review all the systems in order for people to get the care that they need. So when you get dismissed by this person sends you here, this person sends you here, this person sends you here, all of them dismiss you, and then you end up having something serious going on. It leads to a lot of different feelings that are less than ideal: mistrust, disappointment, like sadness. And so it's also important to acknowledge
Betrayal.
that it's also important to acknowledge that all of those things are real too, because a lot of times by the time people come to see me, it's already been a very frustrating experience for them. So just kind of letting people know that that is a valid way to feel within the systems that we're in. And I mean, I'm a patient within the system. You're a patient within the system. And so it's like, I understand those feelings.
Yeah. And there are, I'm just going to throw this out there. We both have a friend, Dr. Dan Moore, who's the opposite of that.
Oh my gosh.
I worked at a primary care office for a couple years, and I was routinely one of the first doctors out, and it took me an hour at the end of the day to finish my notes. And 2 to 3 of the doctors were still there finishing all of their notes, because in an 8-hour day they had to see 35, 40 people. And there's no time built in there to have a real conversation like you're talking about.
No, and Dr. Dan is my primary care physician.
Well,
so
there you go.
I'm the patient, so HIPAA-wise I can say this.
Right.
But that's why I specifically chose to work with him is because he sits with you and walks you through all of your medical history. And the other nice thing is every clinician is human. Nobody knows everything.
Right.
So it's really important to be working with people who are like, oh, like that's a new one to me. Like
Yeah.
I really like Dr. Dan
Yeah.
because you're sitting in his office, and me being deep in some of the research that, you know, it's 2023, different ideas. He'll be like, oh, I haven't heard of that. Like, let me pull that up and see what I think. And so it's nice having providers. And so it's nice in the Richmond area because over time, I've had my business for 4 years. So I've been able to build my referrals of providers that I really trust and know that they're going to treat clients well. But it's hard sometimes when you are new to an area, or if you're not a clinician. Like even when I was working not within my own practice, I was so busy, like you were saying, treating patients, doing notes, that my bubble was so small, I didn't have time to go explore and figure out who were good referring providers. I had really good referring providers who would send me clients, so that's how I knew providers in the time. But it's so different when you're seeing people in office, you know, one-on-one, seeing how they work with clients and how they interact.
Right.
So, yeah.
Well, this has been awesome. Tell people how they can get in touch with you.
Yeah, so the easiest way is through my website, which is mindfulmovement-pt, as in physicaltherapy.com. You can get the book at eating-moving.com. And feel free to reach out via email. I also have Instagram, so mindful movement _-pt. I don't remember which one. And then the book is eating period and period moving. Okay. So yay.
That's awesome. Okay. So that part, it's very easy for people that need you to see that you're passionate about it, that you understand what's going on. And if you don't think she knows research, look at the book.
Yeah.
My gosh. My wife was so happy when she saw that. She was like, wow, because she was a researcher. Anyway, the next portion of this is more, can they connect with you?
Yeah.
Right? It's getting to know Dr. Karst a little bit better. So the first question I always ask is, what is the best piece of advice that you've been given or given yourself or in your field?
Yeah, so I've been taking coursework with the Baral Institute, and one of my teachers that I've studied extensively under in the past couple years, he always says, you do more than you know. And I think that's a really good reminder, because sometimes as clinicians, we're fixers. So we want to solve the problem. We want the body to react how we want it to react. And I think that's a really important piece of advice, because just because you want the prognosis to progress in a certain way doesn't mean that if it's not exactly how you imagined it healing, that you're not making a difference. So it's just a reminder that how you show up for your people, how you interact with people, and how you work with people can have more of an impact than you know. And, you know, I don't know about you, but I like feedback, but sometimes you don't get it. And so it's also a reminder that, you know, even if you don't get feedback, that there may still be a difference.
Right.
So.
Right.
Yeah.
And then there's also the very fact that body still keeps working after they leave your office.
Exactly. Yeah.
So there's stuff that I'm doing. I'm like, all right, you're going to be sore for 2 days.
Yep.
Today is Thursday. Friday and Saturday, you can blame me for the soreness, but on Sunday, whatever's there is still left from the injury.
Yep.
You know what I mean?
And
so
that's
it's like,
that's exactly
this
what
is
I
a
say too.
3-day process here.
Yep. Yeah, I'm like, you're gonna like me more or less before you like me more.
Right.
But yeah, it's
Unfortunately,
about resetting that equilibrium and kind of so once they leave, taking your hands off and letting the body do what it needs to do.
Letting the body do what it does,
and each body is just different, you know, and how it processes, how it receives information and all of that. So just letting the individual body figure out what it needs to do.
Absolutely. On the other end, what's the worst piece of advice?
So I think that, my clinic is out of network.
Okay.
At the time that I started it, there weren't as many out of network clinics locally. And there was a little bit of debate of why would somebody come to see you and pay cash with essentially depending on reimbursement, if you have out of network and HSA, FSA, when they could see somebody in network who's been practicing forever.
Right.
And my thought on that is that you could be the absolute best clinician in the entire world. You could be board certified, you could have all the letters, do all the things. But if you're only getting 15 minutes per patient, how much good are you doing? Because even if you're the smartest person in the entire world and you know everything, your patient, you only have the 15 minutes. And so in that 15 minutes, how can you meet the patient where they are?
Right.
And be able to explain to them what's happening in their body in a way that they understand, not in a way that you understand, and help them feel empowered to do what they need to do. Because
Right.
I don't know about you, but I am not the ideal patient. I'll just admit that. But I will say, because of that, that's kind of how I treat, where it's like, if somebody tells me to do something, maybe I'll do it. But if somebody tells me, okay, you're going to do X, Y, Z because this is why it's good for your body, then I'll be like, oh,
chance.
yeah, exactly. It's like, oh, okay, I guess I should do this thing that I don't really want to do.
Right.
So I think that, like we talked about before, being able to listen and spend time with clients is really the only way to get a root cause and to not just be another practitioner putting a Band-Aid on the solution, or a Band-Aid on as a solution.
Right. Couple things that I tend to say is, if you have somebody else pay me, now legally I work for them, not you.
Yeah.
I would rather work for you than somebody that may randomly deny something that you need.
Yeah.
I'll be like, hey, we'll pay more for something that doesn't work as well.
Yeah.
Why would you do that?
Well,
But,
and that's exactly the big problem. And a physical therapist friend and I had lunch, and she's within the hospital system. And it's so frustrating because the people making the decisions about care often have no background in care.
Right.
So they're making the rules and regulations within these big systems, but they don't know what it takes for a patient to get better. They don't know what clinicians need in order to help their clients. So yeah, that's actually I'm going to steal that from you.
Yeah, that's fine. I remember that in a job that I had previously, is that I was having to defend my care plan, and they were saying, well, this is beyond what their coverage allows, so we're going to stop doing that, and we're going to do this because this will be covered. I'm like,
yeah. Well, and this is what I tell people about medicine is that when I went to PT school, you go into a medical program with the goal of helping people, usually, hopefully. Ideally. But when you get in, you go through all these classes on like, how does the body work? How do the joints work? Like all the conditions, all of these different science things. And then you get into clinic, and what's so frustrating about Western medicine is you think you're going to get in and you're going to be challenged to learn more about the body and how to help people. And the reality is, in network spaces, a lot of it is going in and being like, okay, you have Cigna, so I have to do XYZ with you. Or like, oh, you have this, so before you can get PT, you have to do that. So it's so much more like not looking at, so say Susie's the patient. It's not looking at, okay, like what's the best plan of care for Susie? Like what would I want somebody to do with me? It's, okay, well, Susie has Aetna, so what we should do is this, but because of the Aetna, what we have to do is like go around this way. And so it's a lot of hoops and hurdles that take up brain space for clinicians. So then at the end of the day, when they're going to work with the clients, they're already like maxed out with thinking about what the plan is, not based on their clinical judgment, but based on who's paying them. Paid. You know what I mean? Yeah.
Exactly.
I mean, so
it's obviously we're in agreement that, being able, like HSA and FSA are probably the best things you can get if you have insurance.
Totally.
Because then you have more choice, and it's actually you that the patient works for, or that the doctor works for.
And the other thing is asking about payment plans, because I offer payment plans in case people, if that's makes it more feasible. Yeah. And that's the thing is, call and ask, because a lot of times if you know what you're paying, you can plan. Honesty and transparency are so important. So you can plan around like what works for you in the season. But if you go and you have no idea what your bill's going to be, it makes it a lot
Right.
harder to financially
more
plan as well.
stressful, too.
Yeah,
Yeah.
exactly.
Yeah.
So
And then you have another cascade.
yeah, totally. Yeah, well, and that's, yeah, exactly. Yep.
I know we got off on the insurance thing.
Yeah.
The third question that I'd normally ask, and honestly, like that
Yeah.
leads right into it.
Yeah.
Which is why it's that place in the questionnaire. But how would you describe your purpose in life?
Yeah. So I think my purpose in life is to help people. It's basic, but that involves meeting people where they are and being with them in the room. So, you know, I want to be able to help people in the way that actually helps them and not in the way that I think I should help them. So...
It's so prevalent.
Yeah.
With doctors, that's one of the biggest things that irritates me about doctors is that like a patient comes in with goals and then this is what you should want. And I'm going to build a treatment plan around what you should want.
Yeah, exactly. It's like you met your goals and you're like, but did you ever ask me what my goals were?
Right.
You know, so yeah, exactly. So treating each person like an individual and treating each body like an individual. And then I like learning. So as a human in a body, my joke is it's, you know, the more you know about the body, the more you can understand about yourself. So I think it's just like a nice practice.
Yeah, absolutely is. In a similar vein to what you just answered.
Yeah.
What is something that other people value that you don't?
I am pretty minimalist.
Oh, okay.
So not that I don't like things, but I don't need a whole lot. So yeah, I don't need
Just
yeah, exactly. Like I would rather spend my money on experiences and being with people. I love food. But as far as like accumulating things, I feel like that's not my purpose in life.
Okay.
Yeah.
So I guess does that translate into travel? Like
Yeah.
like,
Yeah. Oh yeah.
I got to do the street vendors in China and
Yeah.
like,
I want to get
there's
more
some
adventurous.
really good food in streetcars.
Yeah,
Streetcars.
I've been taking a lot of my coursework in Seattle, and so this time the course was right by Pike Place.
Okay.
And so it was so fun. It was very rainy, but I actually don't mind the rain, so I just throw on like all my layers and my rain jacket because I went in November. And it was so fun getting to see the different vendors and the different businesses and kind of do some exploring. So yeah, I like being in new cities and exploring and seeing how different cities work and you know what businesses are like and all of that fun stuff.
Yeah. Getting to travel and seeing different people in different environments and different cultures, it's one of the best ways to build empathy, isn't it?
Yeah, it is.
Man.
It is. And honestly, it's nice too because you know, creating space from your environment often makes you more grateful for it, you know? So it's like, okay, I had my fun and did all the different things, but I like my clinic space right now. And so it's nice returning to like a quiet, peaceful clinic space, like with my one-on-one care and not a lot of like noise and all of that stuff in the background. So.
Gotcha. If you were able to create one law that everyone had to follow, what would you do?
Okay, so I think, first of all, everybody just needs to be kind to each other because you really don't know what other people are going through. So I think that's a big one. But could everybody just use their turn signals? I mean, like, really be kind, but like also part of kindness is just like use your turn signal when you're driving. So so those are my two laws.
Okay, that works. It's a sub law.
Yeah, exactly.
Sub-law.
Yeah.
Okay, so other than this one, pick any genre. So it could be a podcast, a book, a movie, TV show. What is one that you're passionate about?
Yeah.
And why?
So I've been listening to the Doctor's Pharmacy, FARM, and that's a podcast with Mark Hyman.
Okay.
And he has some really good information on it, and it's functional medicine. It's pretty accessible. So some episodes are a little bit more science heavy than others, but it's a nice dabble into thinking differently about health. So that's one that I have enjoyed. And then as far as books go, The Myth of Normal by Gabor Mate is a really...
Never heard of that.
Yeah, it's really good.
The Myth of Normal.
Yeah.
Huh.
And so they did a podcast on Mark Hyman's podcast together on trauma, and it was really... I see a lot of, trauma is an area that I specialize into, and a lot of people who come in it's like an onion, have layers. But it was a really refreshing podcast to hear two male physicians talking about trauma and how trauma informed their lives, and just, different aspects of medicine and their growth within the fields and perception versus the actuality in different ways. So that's a really good episode. And that's what got me interested in looking at the myth of normal. And the myth of normal is about just how different conditions are related to different things, and how our environments are kind of shaping some of the modern problems in different ways. So both very good.
Wow.
Yeah.
Okay, so we go on to, you said it was the Doctor's Pharmacy with
Yep.
an F, and it's an episode with
Yep.
this guy. Okay.
Yeah. Yeah.
All right, so we're almost done.
Yeah. Oh, yeah.
When you're done, how do you want to be remembered?
I think I just want to be remembered as being kind. I know that's come up a lot, but I just feel like
It's important.
it is, and it's often lacking. I mean, I think that because everything is so digital, and my phone isn't on me, and so it's just we're so connected to our phones and to screens that it makes it really hard to be a human. So I think we're missing, like we're having now, these one-on-one connections where we're not looking down at a screen or checking our email or anything like that. And I think that also affects how we feel in a lot of ways, lacking that connection, attention, all of that. And so I think, baseline, just being a kind person, because I think that we just need people to be kind to each other right now. Because again, like I said, people look like they have their stuff together often, but you just never know what people are going through. So when in doubt, instead of getting mad or being overtaken by anger because of fear, all of this stuff, it's like, what if you just thought about what might be going on in their life? Or what if you asked? Like, somebody's grumpy, like, hey, how are you doing? What's going on in your day? Like, and then you might find out something crazy, and you're like, oh, okay, I'm glad I didn't react how I initially wanted to. So kind of that space between action and reaction.
Yeah, I get it. That's part of, honestly, why I'm into that section. I've moved over my 10 years of being a doctor and 20 years of helping people, and 22 now. But why I've kind of honed in on trying to get people out of pain as quickly as possible, because it's very, very hard to think about somebody else when you're in pain. Right? So it makes a selfish man out of every one of us. You know what I mean? Like, and I'm just, if we can get to a place where we like to judge ourselves by our intentions, or what we think our intentions are, right? And then we tend to judge others through a filter of our insecurities. You know what I mean? And the less physical pain you're in, the more you're able to be generous and to be kind and interpret things with an assumption of good intention.
And that's so funny, because you just verbalized how I feel too, with, like, when you educate people and help them feel better, exactly like what you were just saying, then they can go ahead in their lives and have better interactions with those around them. You know, so it's that small ripple effect that makes such a big difference. And health-wise, if you've never been taught anything about eating nutritiously or moving and the importance of both of those, when you leave, and if you're making these small choices, then you can take those, and somebody sees it's like, oh, what are you doing? And so it ripples in that way too. So agree. I really love the ripple effect.
Honestly, that leads right back into one of the things that I loved about this, is that, we all know it's called a cycle, but what that means is that there are different steps of what your body's doing at different times in your month. And this is literally is, during this phase, do this. During this phase, eat like this. And it's really a coach in itself that you guys put together, and it's really good.
Thank you. And it's honestly, it's been an interesting journey over the 4.5 years of writing, because I've been in it, researching and writing, but I've realized how much more kind I am Because I understand what's going on in my body. So, you know, if there's a time in my cycle where I'm a little bit grumpy, I can verbalize that and be like, hey, like, or just step away from situations that may not help with that in that time of the month. So it's been really good for me to be able to help people in my life understand me, because I'm better able to verbalize my needs during the different phases. So that's been really cool too.
Yeah.
Yay.
All right. Well, thank you so much for being on.
Yes, thank you.
Can you tell them again how to get in touch with you?
Yeah, so my website's super easy to find, mindfulmovement-pt.com or eating-moving.com. If you fill out the contact form on either of those, it'll go straight to me, so I will get that. And then Instagram, eating, moving, and then mindful movement, either dash or underscore PT.
All right. And honestly, I got this off of Amazon.
Yeah.
So, you know, you can get that there too.
You can get it on Amazon. We just were able to switch it on our website, not through Amazon.
Okay.
So if you're, I feel like
the website is better.
Yeah, the website's better.
The website's better. Okay. Thank you again for being on the show.
Thank you so much. This was great.